What are the clinical features of chemical injuries? A patient with a chemical injury presents with pain, foreign body sensation, blurring of vision because of corneal injury and edema, excessive watering, there will be a lot of photophobia, and there will be a red eye, there will be diffuse congestion in and around the eye. What are the effects or what are the signs of chemical injuries? These chemicals can cause necrosis of the conjunctival and the corneal epithelium with disruption and occlusion of the limbal vasculature. There is loss of limbal stem cells which can lead to conjunctivalization and vascularization of the corneal surface and eventually can lead to a corneal ulcer and a corneal perforation. Once these chemicals penetrate deeper, they can cause breakdown and precipitation of the glycosaminoglycans, and they can cause a diffuse corneal stromal opacification. So you get a diffuse white corneal opacity as you see in this picture. Anterior chamber penetration can lead to iris and lens damage. Ciliary epithelial damage impairs secretion of ascorbate, which is required for collagen production and corneal repair. Chemicals can also cause hydration of collagen, which leads to thickening and shortening of the fibrils, which can lead to an increase in intraocular pressure. Late sequelae, what we can see is we can see symblepharon. What exactly is symblepharon? It is basically adhesions of the palpebral and bulbar conjunctiva. So what we see in this picture here, you have the palpebral conjunctiva stuck onto the bulbar conjunctiva. There can also be cicatrization of the conjunctiva, and there will be inward rolling of the lid margin as we see in the second picture here, which is called as entropion. So these are late complications which we see in case of chemical injuries. There is a grading system for these chemical injuries which is called as Roper Hall grading. It is divided into 4 grades depending upon the amount of corneal and conjunctival damage and also the type of prognosis. So as per grade 1 Roper Hall grading, cornea shows just mild epithelial damage and conjunctiva shows chemosis but does not show any form of conjunctival ischemia, and these cases are said to have good prognosis. Grade 2, cornea appears hazy but the iris details can still be seen. Conjunctiva shows chemosis and there is conjunctival ischemia or limbal ischemia involving less than 1/3 of the limbal conjunctiva, and these cases also the prognosis is said to be good. Grade 3 shows corneal epithelial loss with hazy corneal stroma, but the iris details cannot be seen now. So it is a little advanced stage of corneal involvement. Conjunctiva shows limbal ischemia involving 1/3 to half of the limbal conjunctiva, and these cases the prognosis is guarded. Grade 4, the entire cornea is involved, so entire cornea gets opaque and we cannot see any posterior structures, we cannot see the iris and the pupil. Conjunctiva shows chemosis, ischemia and necrosis of more than half of the limbal conjunctiva, and these cases the prognosis is said to be extremely poor.